Hello Joel, I'm here to learn a little bit more about the cover, the bad thing, and the tests that doctors are able to do in order to catch this early. I know there is a test for the bowel, and I was hoping that you'd be able to give me a bit more information about this.
Hi James, yes of course. So at around the age of 50 you will be invited to take part in bowel screening. This comes in the form of a letter. You do not need to respond to this letter. Then 2 weeks after this invitation letter you will receive a test kit in the post.
I have a cousin who struggles to read. Is there any support services available for individuals who do struggle with reading and writing?
Yeah, there are some visual instructions on the lid, inside lid cover of the box. You can call the number on the invite letter. This is for the regional hub, and they can answer any questions you may have. You can even request an easy read leaflet. Their number is a free phone number. It's 0800 707 6060.
And when the test is actually sent out to me, I wouldn't want neighbours or family members maybe knowing that I'm doing the test. What can I expect it to look like when it comes through the post?
Sure. So it comes in a box like this. It contains the instructions on the lid, a tube with a stick inside for collecting the sample. The only writing is to write the date on the side of the tube. You place the tube in the envelope, prepaid, and send it in the post.
And do I need to be registered with a GP in order to have the test?
Yes, GP registration is required to be invited for bowel screening. However, you can be temporarily registered with the GP, and if you need help with that, you can contact FFT.
And how long can I expect the wait for the test results to come back? It's obviously going to be a really anxious period of time waiting.
Yeah, so the results take 2 weeks to come back. This will be in the form of a letter. Most people, around 98 out of 100 people, will be told no further tests are needed at this time, which means nothing unusual was found. If your letter says that further tests are required, this means that blood was found in that sample, and we would like to offer you a colonoscopy.
And for the colonoscopy, would I be able to request a same gender medical professional to conduct that test?
Our advice would be to always take the earliest appointment to avoid any delay in your investigation. However, if there is a male-female option, we would do all we can to accommodate you. This may mean travelling to a bowel screening facility a bit further away.
Okay, and why are these so very important to have these tests done?
Yeah, so screening can pick up cancers at an early stage when there's a good chance of successful treatment. If a cancer is found at the earliest stage, more than 9 out of 10 people will have successful treatment. Also, this test can pick up other growths in the bowel we call polyps. Now, these polyps can be easily removed during a colonoscopy, and over half of the people who have a colonoscopy with screening will have these polyps. And remember, even if you're too young to be invited for screening, if you feel something unusual, something isn't feeling normal about your body, always go and see your GP or trusted medical practitioner.
Absolutely, that is the key advice. I think if you do feel anything unusual, I think we all know our bodies. The advice is to, as soon as possible, reach out to your GP and to have one of these tests.
Yeah, exactly, definitely. Don't wait to be invited for screening.
Brilliant. Thank you, Joel. Thank you very much for your time. And if anybody watching is struggling to access services or is not registered with a GP but would like to have this test, please do reach out to friends, families and travellers, and we'll do all we can to support you accessing this vital test.
For an information leaflet, pause this video and scan the QR code below. Or if you want to talk to someone, contact FFT's confidential helpline on 01273 234 777.